A small number of Americans in the Democratic Republic of Congo have been directly affected by the Ebola virus. This as cases rise in Central Africa. This is according to the U.S. Centers for Disease Control. The CDC also says that it's working with supporting partners to get these Americans out. In a statement, this is what we heard from the CDC. They said this, quote, "The CDC is supporting interagency partners who are actively coordinating the safe withdrawal of a small number of Americans who are directly affected by this outbreak." The U.S. government is reportedly trying to get these Americans out of the DRC to an area where they can be isolated and treated if they are infected. Now, this comes amid a very worrying outbreak of the Ebola virus in Central Africa, centering in Ituri province in the DRC. It's also happening with cases in neighboring Uganda. There have been at least 80 suspected deaths. The case count is on the rise. Ebola is, of course, a severe and often deadly disease. Historically, it has a fatality rate of anywhere between 25% and 90%. And this has all prompted the World Health Organization over the weekend to issue that declaration, calling this a, quote, public health emergency of international concern. Now, I recently spoke with Dr. Piot. He's a world-renowned microbiologist. He's also a co-discoverer of the Ebola virus. And he told me that this outbreak in Central Africa is a, quote, serious regional threat. And he also told me this, quote, "Let's not forget, this is a region with high insecurity." He's making reference to the ongoing fighting there. High population mobility, and this is an unusual strain of Ebola. It's called Bundibugyo, and we have no proven vaccines or treatment. So it has all the elements for a much larger outbreak, unquote. And Rosemary, Dr. Piot also adds that he believes that this latest outbreak of Ebola may have been circulating undetected since March. That's 2 months ago.
Unbelievable. And Kristie, what effect have massive US cuts to overseas aid had on the ability of Central African countries and, of course, international bodies to respond to this outbreak?
Rosemary, this is the key question that our editorial teams at CNN is digging into at this very moment. We've had those massive cuts to U.S. aid. We've also had the United States withdrawing from the World Health Organization. And experts have long warned that cuts like this could have a devastating impact on disease surveillance as well as emergency response, especially in very fragile areas. The World Health Organization is saying that it is ramping up its international response, and an international coordination is needed here. Again, citing my conversation that I had with Dr. Piot, he said the immediate priorities are patient care, isolation, frontline protection, making sure that the frontline healthcare workers have their PPE. And he says international support and coordination will be essential to contain this outbreak. Rosemary.
Kristie Lu Stout in Hong Kong, many thanks.